Hello everyone, this is my oral presentation for my signature assignment SOAP note case. My name is Angelique and I'm currently completing my clinical rotation at Dr. Abu Kamli's office, an internal medicine clinic located in Apple Valley, California. Today I will be presenting a case that was rather recent but particularly meaningful to me. It was a 32-year-old African-American male who came into the clinic with a chief complaint of my heart is racing and I'm losing weight without even trying. Why was this case so meaningful? Well, this case stood out to me not only because of its clinical complexity, but because it truly tested my ability to think critically, holistically, and compassionately as an advanced practice nursing student. It was meaningful because this patient initially presented with symptoms that could easily be mistaken for drug abuse, which is a problem in this area, or anxiety, a common misdiagnosis in young adults. However, the complexity of his case required me to go deeper and challenge my own assumptions. It reminded me of the critical role nurse practitioners play in preventing misdiagnoses, especially in underserved populations who may not have regular access to specialists. This also gave me the opportunity to apply Gene Watson's Curative Factor number 8, creating a healing environment at all levels. By holding space for his emotional distress and anxiety, I was able to form a trusting connection to help him understand that what he was experiencing was not just all in his head. When he said, "I thought I was just super stressed out," which I'm sure we've all felt before, it was a powerful moment that underscored how important it is to listen beyond the surface. Additionally, I applied Curative Factor number 4, developing a helping, trusting, human caring relationship. I intentionally built rapport through non-judgmental listening, clear communication, and emotional presence, making him feel seen and heard. A brief presentation of this case. The patient LM is a 32-year-old African-American male who presented alone and was a reliable historian. He complained of palpitations, weight loss, heat intolerance, anxiety, insomnia, and this all began about 3 weeks ago. He also reported a 10-pound weight loss, which was completely unintentional, despite his increased appetite. His symptoms were distressing enough to not only affect both his sleep, but his work performance as well. His past medical history was unremarkable except for seasonal allergies, no surgical history, no previous hospitalizations, and no previous psychiatric issues. His social history was revealed that there was no substance abuse. Everything else was pretty much normal except for the disrupted sleep. Family history, however, supported the possibility of a familial autoimmune thyroid disorder. Review of systems was positive for anxiety, tremors, heat intolerance, and palpitations. So my objective findings. Vitals were shown that he had tachycardia with irregular rhythm. So he had a heart rate of 132. Otherwise, vital signs were completely normal, totally stable. BMI was normal, but 10 pounds down from his previous visit. On physical exam, he did appear anxious. I also noted lid lag and a fine motor tremor in his hands. His skin was warm and moist. No goiter was palpable, but cardiac auscultation revealed an irregular rhythm without a murmur, which of course raised concern for atrial fibrillation. So in doing my differential diagnoses, initially I considered these 3 diagnoses: generalized anxiety disorder, thyroiditis, and Graves' disease. However, with the presence of the objective signs such as tachycardia, tremor, lid lag, weight loss, combined with the family history of Graves' disease, it strongly shifted my clinical reasoning toward endocrine etiology. According to the American Thyroid Association and Ross et al., these symptoms, of course, are hallmark indicators of autoimmune hypothyroidism. So my final diagnosis, the primary, was Graves' disease, ICD-10 code of E05.00, and secondary diagnoses of suspected atrial fibrillation, ICD-10 code of I48.91. So in the plan of care, the diagnostics that I ordered were a TSH, free T4 and T3, TSI antibodies, CBC, CMP, and of course, an immediate EKG. Treatment. So we went ahead and started him on methimazole 10 milligrams daily, which is the first line anti-thyroid drug. I also started him on propranolol 40 milligrams PO twice a day to manage palpitations and tremors. We did a referral to cardiology, of course, but also we did an urgent referral to endocrinology, actually calling the local endocrinologist and speaking with him over the phone. This way he could do the definitive therapy, but he's actually the one that recommended the methimazole. So therefore, with education, of course, I educated the patient about the methimazole side effects, the nature of Graves' disease and its autoimmune origin, symptoms of atrial fibrillation and when to seek care, and lifestyle changes, of course, avoiding stimulants and improving his sleep hygiene. Follow-up, of course, he's going to follow up with both the cardiologist and the endocrinologist, but to return in 2 weeks for a lab review and symptom reassessment so we can make sure that he's doing better. This is obviously very distressing to him. And also when to go seek emergency care, when to go to the emergency room, and of course, the symptoms worsen. Holistic approach in caring science. Well, this case reminded me of the importance of a holistic approach, addressing not just the symptoms, but the emotional and psychological experience of the patient. I collaborated with our clinical social worker to assess for barriers to care, such as insurance coverage and emotional support. But I also acknowledged cultural considerations that can affect seeking care behavior, particularly for African American men who often faced a stigma around emotional health or systemic barriers in healthcare. Gene Watson's curative factors, number 4 and 8, help to guide my presence and communication. This is not just a diagnostic process. It was a chance to restore trust in the medical community and to offer hope for this patient. In conclusion, this case helped me grow as a future family nurse practitioner by reinforcing the importance of listening beyond the symptoms, using evidence-based resources such as our clinical practice guidelines, and staying rooted in the principles of caring science. This case reminded me that holistic care is not separate from clinical excellence. It's how we deliver it. Thank you for listening.